Welcome back to Central Valley Talk. It is Wednesday in the 3 o'clock hour, so that means we're talking seniors issues. I think seniors were old people, but it's me now. I'm a senior. So anything that seniors face, from housing to insurance to medical to transport, all these things are, we're going to talk about them on this show. So if you're in the industry, you want us to tell you about your service, come on the show. If you're a senior, you just want to come on and complain, we can do that too. So seniors issues every Tuesday, right? Mm-hmm. Every Tuesday at 3 o'clock. Our first guest today is Tish Davis from Auspice Home Care and Transportation.
Yes.
Did I say all that correctly?
You said it correctly. And
Auspice.
you pronounced it correctly,
I know,
too.
Auspice. I have a lot of practice. Auspice has been on our show a lot over the years, and we appreciate that very much. And you provide great services.
Yes, we do.
And I talked about the prices before we came on the air. I thought, really, that's all? So I was surprised. I don't know if you want to talk about them on the air. We'll see when we get to them.
Yeah.
Tell us about a couple of the things you guys do. I mean, it says Auspice Home Care and Transportation.
Yes.
That's it.
That is what we do. So we do, we started in 2009, so we're on year 14.
Wow.
The owners we're a mom and pop company. We're born in Fresno and we've stayed here, so it's a local company. So in-home care is sending a caregiver to the home. So if you need help with, let's just say, help in the shower or help to the restroom, remembering to take your medications, meal preparation, need help around the house with housekeeping, laundry.
Anything like that you maybe can't or don't want to do right now yourself. Yeah. Now, how many hours is a caregiver?
So we have no minimum, so we can come out from 1 hour a day all the way up to 24 hours.
Yeah, I was going to ask. Some people need 24 hours.
Yeah.
But some people just a few hours. So getting the stuff off the shelf and getting the
or just we go in and help make the bed.
Yeah.
Like making the bed's difficult when you get older. Taking laundry out of the dryer and folding it. Those simple things like that.
Simple things like that. Yeah. And remembering to take the meds, that's a big one.
It's very important, yeah. And eating and drinking with those meds.
Yeah. Now, so in-home, anybody could call you and just say, hey, this is our needs, what does it cost? And they could decide they need you or can't, or we can only afford a couple of hours. It's easy just to talk to you guys and find out.
Oh, yeah. Yeah, we'll give them, we'll assess what their needs are and kind of tell them what the price is, and they'll look it over their budget. Unfortunately, in-home care is only is private pay, which means you have to pay out of pocket unless you had a long-term care policy.
Right. So. I have in-home care because I have a housekeeper come in a couple days a week, and I have this and this. So it's the same. I paid private pay.
Yeah, DoorDash.
DoorDash, yeah, that's all private pay. Now, and I can imagine, we don't have to go into much detail, who needs in-home care. Well, anybody can need in-home care. So. Yeah. And you guys provide that. You guys are professional, they're trained, and they know what to do.
Licensed in 2016. All home care agencies have to be licensed through the state of California.
Wow.
Yeah.
You guys, a lot of things happened since you started in 2009.
Yes.
It's professionalized the industry.
Yes.
And I think that's good.
Yeah.
It's a lot of people just doing it on the side and stuff, but now it's professionalized. And
you have to pay it. It's a very stiff licensing fee, so you really want to do it if you.
Now, let's talk about the transportation. Who needs that?
Everybody, and kind of with the home care too, with medical transportation. We're taking people to dialysis, chemo, adult daycares, doctor's appointments, you name it.
Now,
pharmacy.
An ambulance is really, really expensive, like $6,000 or something.
It's expensive if you have to pay for it.
But you guys aren't that.
No, we're. I'll just throw out a number. We're around, if you needed to go to a doctor appointment, private pays around $80 for the Fresno Clovis area, but we do accept managed Medi-Cal too. So.
Oh, you do? Okay. Yeah, we never asked prices on this show, so I was hoping you would say it. But yeah, when you told me that price, I was shocked that it was that affordable.
Yeah, it's really not.
It's like taking an Uber or something like that.
Yeah, and that's, we take people ambulatory. So ambulatory means they can get into the car or they need to use a walker, people in a wheelchair, and people that are on jerry chairs.
Okay. Yeah, sometimes it's hard to get in that car, even if you can walk around, that car's tough to get in.
Sometimes they're too low or they're too high. And we have the wheelchair accessible vehicle, so if you're in a wheelchair, you don't have to get out of the wheelchair. We just wheel you in and safely strap you in.
Well, another thing is it's not affordable. People, you're always waiting on your son or your daughter or your neighbor to take you. Just call Auspice Care.
Yeah.
and get it professionally done too.
Yeah.
And so you could schedule them in advance?
Yeah, we give us like a day's notice, and then we can get you on schedule. We do about over 125 trips a day. So.
Oh my goodness.
Yeah.
Do you ever do the driving?
I sure do.
You,
Yeah.
Tish do? Request Tish, not really.
Yeah.
She's busy over there. How do they reach you? They just phone up? What's the phone number?
Our phone number is 559-436-4782.
4782. The reason I have Tish on is I want you guys to know that this is out there, that
Yeah.
this exists. I had no idea until, I mean, you've been on the show, but I
Yeah.
really didn't get until today that it's affordable and it's something we need. And
Yeah, a lot of people think it's just for the elderly, but we have kids, mid-age, everything, yeah. Because you might have surgery and you might need help for a week, and then you don't need us anymore, but we do have no contracts, so we can come out for 5 days up to forever. So.
Or just come once a week, like you said, help clean up, tidy up a little bit,
Yeah.
do some chores around
We even
the
help
house.
people like clean out their fridge and their cupboard to get rid of expired stuff, and yeah, simple
This is a
stuff like
great
that.
service. Is there a website or something that people could go look at all these services?
Yeah, it's kind of like our name, www.auspicehomecare.com.
AuspiceHomeCare.com. By the way, if you're watching at home and you didn't get the information out, call me here at Central Valley Talk. I'll give you the information. And AuspiceHomeCare.com. Call them up. You need a lift. And you don't have to be an elderly or disabled person, but somebody who just kind of needs a little help
Yeah.
getting from here to there.
Yeah.
I like that. And they're professional.
We're professional,
And
licensed.
and licensed.
And bonded. all
Probably
that good stuff.
insured and everything
Yeah.
like that. What else do you want our viewers to know?
Let's tell them about our upcoming event. Our
Okay.
annual event is called the Celebrating the Caregiver. That is you're going to find all kinds of community resources with, with home care, caregiving needs. It's going to be on Saturday, March 4th. From 8 to 2 at People's Church. And if you don't know where People's Church is, it's Cedar and Herndon. It is a free event. You get breakfast, lunch, and all the necessary resources. Speakers are going to be out there. There's going to be 3 different sessions that you can choose a speaker.
And the
Yeah.
caregivers should go.
Caregivers should go. People planning, because we're all going to get older, so just, you might be in your 30s, but you should just see what's out there for your parents, your grandparents, because a lot of people will come to our company in crisis, so it's better to have a plan in place.
Great.
Yeah.
This is what I say about the senior show. It's if you're going to need senior housing now, watch this show. If you're going to need it in a couple of years, or you're kind of helping care for somebody that is going to need, watch this show. And that's what you're saying about this caregiver conference is you don't have to need all this stuff now, but you're going to need it soon.
Yeah, there's
So come learn about it.
26 vendors that are going to be
Wow.
there. Yeah, just grab a brochure, keep it. You never know when you're
Are
going to
you
need
guys
it.
putting this on?
Yeah, us, People's Church, and I have a great committee behind us, and then we have sponsors that help us, pay for the food and the advertising and
Oh,
all
there'll be
that good
food.
stuff. Oh, yeah, we have Porta Subs is the lunch, and then we have Uncle Harry's Bagels and some, continental breakfast in the morning, and then we're going to have some desserts and
Right.
lots of good stuff.
There's a lot of frustrated caregivers out there that
Yes.
just they inherited the job, it's their parent or their spouse or something. I bet they would benefit from coming to this and finding resources that are out there for
Yes.
them.
It very definite. I've been doing this for 14 years, and I'm actually have turned into a caregiver myself.
Mm-hmm.
So,
Stick with it long enough.
Yeah.
We're all going to be caregivers
Yeah.
or need a caregiver.
or just know of who you can turn. Just people you might be a caregiver and get burned out, and you need someone to just vent to or
Right.
talk to. There's support groups out there for caregivers,
Yeah.
and
Also, I keep thinking of people. I know a woman, and she's always there for her husband, not because he has Alzheimer's, just he might fall or this or
Yeah.
that. She could just use a break.
yeah, and that's called respite. So
Yeah.
that's a respite break.
Respite, okay.
So
Auspice would be good for the respite
yeah,
break. Go on.
respite, because you can just come in. We could come in. You are the wife, and you need to get your nails done, or
Yeah.
you just need to go have tea with friends,
Yeah,
or
just
go
need
to happy
get
hour.
Just get away for a little
Yeah,
bit.
just
huh?
get away. But then you know that your loved one, because if you do have a husband that's a fall risk, and you're always worried about leaving him alone, you can have a caregiver come in just for 3 hours a month, and
That'd be nice.
Get a
Yeah.
break.
There's no big contract with you guys.
No.
No, you must commit to this and this. Or,
no 3 hours a month, 3 hours every 6 months is
Yeah,
perfectly
I like
fine.
that.
Yeah.
I'm glad you came, Tish. This is very exciting.
I'm glad
Anything else you want our viewers to know? Tell us when this conference
Oh, yeah.
is.
So again, Celebrating the Caregiver, Saturday, March 4th, from 8 a.m. to 2 p.m. People's Church, Cedar and Herndon, and it is free.
Free. I like free. And there'll be some free food, too.
Yes.
I like that. All right. Thanks, Tish, for coming.
You're welcome.
The show is Central Valley Seniors Issues. We're going to have one more guest coming up. Hope Broski telling us how to get in shape a little bit for seniors. We'll be back with more right after this.